Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. Friends, you know that we are discussing about some of the very rare disorders in children, which is explained in Ayurveda science. In the last class in this series, we have discussed about Parvanuplava, which is basically a disease related to joints, where we have got joint pain. In this class, we will discuss another important disease which is mentioned in Ayurveda regarding uh, with respect to the children, that is Atyagni. The word meaning of Atyagni means Ati Agni. That means child is having excess appetite or appetite, excessive appetite or voracious appetite. Now, when I talk about voracious appetite, in Charak Samhita Grahani Adhyaya also we find a similar explanation like Basmaka Roga. Samashana, Anashana, Pishamashana, when he also explains the Basmaka. The word Basmaka is explained. Almost all carrying the similar meaning to Basmaka. In Ashtanga Sangraha, Uttara Tantra, first chapter, 70th shloka, Vagbhata explains a very typical disease related to children, especially in the infants. Okay, so that disease is called as Atyagni. So what he says is Bubukshaha Chet Prabalaha. That means child is having excessive or voracious Prabhala. Prabhala means voracious appetite. Bubukshaha. Apastanyasya gacchati. That means child which is just weaned from the breast milk. That means child is almost all weaning from the breast milk and starting the complementary feeding. Apastanyasya gacchati, where he is in require of more calorie. So because the activity level of the child is now increased after 6 months, so he want more and more calories. So therefore he want to take more and more food. So bubukshaha chet prabalaha, because of more activity, exercise and all, the digestive power of the child or metabolic power of the child is also going to increase. Bubukshaha chet prabalaha apastanyasya gacchatihi. So this is quite common after 6 months when or at any time when the child wean from the breast milk. Atyagni Dvijitam tasya. That means this is called as Atyagni. This condition is called as Atyagni. Vidhanam parigarbhikam. You have to treat just like that of the parigarbhika. So parigarbhika is another disease which is related to the feeding and almost all the same thing. Okay, so nutritional issue. Okay, so Vidya Tatragni Dipanam. Vidya Tatragni Dipanam. Agni Dipana is the treatment principle of a parigarbhika. So now Vagbhata is telling that here Vidhanam Parigarbhikam, the same treatment principle which is mentioned in Parigarbhika should be also employed in Atyagni. Now the question comes, Vidya Tatra Agni Dipanam is the treatment principle of Parigarbhika, where we have to increase the Agni. But in this case, Atyagni, that means already the Agni is increased. Now again you want to increase the Agni? This is the question. So the answer is, this is Atyagni, although it is Atyagni, it is not physiological. This Atyagni is because of some pathological factors which is present in the body. So now we have to correct the Agni. Okay, this Agni is abnormal Agni, so we have to bring this Agni back to the normal. Whereas in Parigarbhika, exactly opposite is taking place. There is Agni Kshaya. Okay, so child is having Mandagni, and we are trying to increase the Mandagni by Agni Dipana. Here, already increased Agni has to be brought to normalcy by proper Agni Dipana. Okay, so this should not be confused. So this is what is explained by Ashtanga Sangraha in Uttara Tantra, first chapter, 70th shloka. Now, so this is what he explained. In this case, there will be great hunger as a child which is weaned from the breast milk, and it should be treated just like the treatment of Atyagni or the treatment principles of Parigarbhika. So that means he says that either you treat this disease by the treatment principle of Atyagni, or you treat this disease by the treatment principles of Parigarbhika. Parigarbhika line of treatment is increasing the Agni, that means bringing the Agni to the normal level. Okay, another treatment principle is the treatment of Atyagni. So he explains, Vagbhata explains a separate treatment principle for Atyagni. Okay. So separate treatment principle for the Atyagni is mentioned in the second chapter of Ashtanga Sangraha Uttara Tantra, Bala Amaya Pratishedadhyaya, shloka number 103 to 105. Okay, so what he says is the child who is having voracious appetite or more appetite, excessive appetite, should be made to lick the powder of Vidari, Yava, Goduma, Kana, etc. And this should be added with the more ghee and followed by drinking of boiled milk with honey and sugar. Now, the treatment of Atyagni, when the child is having excessive hunger, voracious hunger, we have to calm down that particular hunger. So what we have to do is we have to give more and more Brahmaniya and Jivaniya drugs. That means the child should be given with that drug which is having high caloric food. Okay, because the basal metabolic rate of the child is increased. Now, in order to make that particular Agni Shanta, you have to give more and more Indhana. So you have to give such a food which is having Guru and heavy and Sneha. Okay, so therefore he says Vidari, Yava, Goduma and Kana like drugs should be given, which is added with more ghee. Okay, more ghee followed by drinking of boiled milk with honey and sugar. This is one of the treatment principle which is explained by Vagbhata for Atikshut. Similarly, another treatment principle for the Atikshut is milk which is boiled with the Vibhita Kamajja, then the milk which is boiled with the two types of Kakoli, again the Brahmaniya drugs, okay, Yashti Madhu and Morata, Madhurasa drugs, and Morata, again Morata is very heavy substance. So that should be given to the child, or the ghee which is boiled with Ikshu Rasa, which is hard to digest. That means ghee should be given, or Ikshu Rasa which is boiled, the ghee which is boiled with the Ikshu Rasa should be given, which is very very hard to digest, and Sneha substance should be given to such a child. Now these are in general the treatment principles which is explained for Atyagni or Atikshut. They are one and same. The chapters he explained is different. Atyagni he explained in the first chapter of Ashtanga Sangraha Uttara Tantra, whereas treatment principles just like Atikshut or same Atyagni, the treatment principle is explained in the second chapter of Ashtanga Sangraha Uttara Tantra. Now we come to the analysis of these particular things. Now, one thing is very clear. When the child is having voracious appetite means, or excessive appetite or voracious appetite means, so basal metabolic rate of the child has been increased. Now we know that according to the contemporary science, it is a thyroid hormones which will go into increase which will go into maintain the basal metabolic rate, T3 and T4. So these are the two important hormones which act on almost every cell of the body. Okay, they have got receptors on each and every cell of the body, and under their influence inside the cell, the basal metabolic rate increases. It is quite obvious that when the metabolic rate increases, there will be more and more production, there will be more and more heat and energy. Okay, meantime the reserve sources of the body is also get depleted, maybe the fat, maybe the carbohydrate, maybe the proteins. So they are all utilized to subside this increased, to pacify this increased basal metabolic rate. So this condition, one thing is very quite obvious, that there is increased basal metabolic rate, Indhana should be provided. Indhana should be provided. So if Indhana is not provided, then it will go into do the Dhatupaka. Okay, so it will digest the body Dhatus only. Okay, so Indhana should be provided. So that's the only way to subside the Agni. Now this being the case, all conditions where there is increased basal metabolic rate can be taken as Atyagni or Atikshut. One of the condition is thyrotoxicosis. Thyrotoxicosis is abnormal production of T3 and T4 which are meant for maintaining the basal metabolic rate. Number two, the same type of Atikshut can be also seen in protein energy malnutrition in the beginning part. When the child is impending towards the marasmus, so child usually have got more and more appetite. Craving for the food will be there. This craving for the food is because of not getting the food. Baby is not getting the nutrition, therefore he has got more crave and more appetite. But as the time passes, this appetite decreases, and when child goes to the stage of kwashiorkor, there is almost no appetite. Another important condition with the increased basal metabolic rate is diabetes mellitus, polyphagia, polydipsia, and polyuria. These are the triad. So polyphagia will be there. There is more and more appetite. Okay, voracious appetite can be seen in case of diabetes 1. So this has to be also kept in mind. Some other conditions are any of the other metabolic disorders, even some of the other metabolic disorders related to the fat metabolism or may be related to carbohydrate metabolism or protein metabolism may lead to voracious appetite. There is one syndrome in which there will be voracious appetite or increased appetite. That syndrome is called as Prader-Willi syndrome. Prader-Willi syndrome. Prader-Willi syndrome is a genetic disorder where baby is having low birth weight or FTT-like condition in the first year of the life. But when baby go to the second year of the life, so he develops more craving for the food, and at the end of the second year he develops obesity. Now Prader-Willi syndrome is an example for obesity, but the presentation is in the first year he has got very low body weight. Okay, maybe he may be treated as FTT, but second year onwards he has got voracious appetite and he eats very much, and then it will lead to obesity. So these are some of the such conditions where we can get voracious appetite. Probably Ashtanga suggests all such conditions has to be looked in whenever the child has got Atyagni. Okay, so therefore he says apastanyasya, that means after weaning from the food, the infant may develop voracious appetite because of various reasons. The reasons may be PM, which is common in that particular age. Okay, reason may be diabetes mellitus, which is also common. Okay, reason may be thyrotoxicosis, reason may be Prader-Willi syndrome, reason may be some other metabolic disorders. Okay, now increased appetite is also seen in some of the conditions where there is increased demand. Now usually after an infection like conditions, body repairing has to be taken place, and as a result the demand of the nutrients is more. So in that child, in that part also, so child may develop increased appetite after some time of the infection, not during the infection, after some time. Similarly, a preterm baby or low birth weight baby, preterm baby and low birth weight baby, after some time, that means at the age of 1 year or 1.5 years, a preterm baby may also develop more voracious appetite or increased appetite because he has to fulfill the deficits. Preterm is born preterm with the deficits. Now as the age passes, it gets recovered. Now for the purpose of this recovering, he may consume more food. Therefore in SGA babies or intrauterine babies, they usually consume more food afterwards. Okay, and the reports also say that preterm babies and preterm babies, especially and low birth weight babies, they have got more tendency to develop the obesity also because they eat in excess later, or parents will give it in excess. Okay, so these are some of the important aspects. So all these things has been explained as Atyagni and Atikshuddha as two important disorders. The drugs which are mentioned here, like this Vidari, Yava, Goduma, and this ghee, all are high calorie diets. All of them are high calorie diet. Now you have to provide indhana. If you don't provide the indhana, they start eating the body tissues itself, dhatu itself. Okay, then proteins, which is building blocks of the body, they will be utilized for this metabolism. Protein loss will be there. Therefore, usually what happens in thyrotoxicosis, child will be very lean because body fat has gone, body carbohydrates are gone, and even the proteins are also get used. Therefore, to save this protein, carbohydrate, etc. for the body growth purpose, we have to give some other extra drugs which are, or food substances which are having high caloric value. Okay, high caloric value. So this is what is explained in case of a Atikshuddha. Similarly, there is one more treatment which is explained, which is quite difficult to explain in the present context. So what Vagbata says is, the child who is suffering from Atikshuddha should be bathed with the water in which the excreta of the dog, crow or cat has been added. Now in the present scenario, it is very difficult to explain this particular sentence. Okay, and before using also, it should be justified. I am not telling that this has to be used. Okay, this is what is explained in the Samhita, therefore I am mentioning. Probably the idea behind this, child bathed with the excreta of the dog, crow or cat, may be to create a negative feedback system. That means we know that Suppose you take the example of thyrotoxicosis where T3 and T4 is abnormally produced, and a strong smell or a bad smell is always a strong reflex to stop the hormonal secretions. This has been evidenced in case of Bhavaprakash explanation, Mallika Hastanyanashaya. Bhavaprakash says Mallika Hastanyanashaya. Okay, Mallika or jasmine flower, so it has got a very strong smell. So when it is kept around the breast area, okay, practically it is seen that in the traditional practice and also in the clinical practice, it is seen that it decreases the breast milk production. This is quite useful for those mother who is having breast engorgement. Okay, so what is working over here is it is a strong smell of Mallika, jasmine flower. Okay, so a strong smell is always act as a negative feedback system for the stoppage of the hormonal secretion. So maybe with this indication, when you are giving bath with this bad smelling excreta of dog, cat or crow, so the excessive production of the hormones which has been taking place, just like in case of thyrotoxicosis, etc., may be negatively inhibited. So this is the idea. However, this must be verified and justified before its practical usage. So this is all about Atyagni, one more important disorders in the childhood practice. Thank you very much. Don't forget to subscribe my channel and also please give your valuable comments. We will meet again with another important Ayurveda pediatric disease. Thank you very much.